you very much. So welcome to this follow-up session. So we will, after this nice introduction of the CNIL, be more practical, I would say. So a little bit of words about us. We are all together included in the GDPR implementation as a lawyer, as for me, as a data protection officer. So you probably know then when you are going to start the implementation of a processing, usually there is a problem to solve. So let's depict first the case study in this case. And then we will interact together by question in order to see how we can get further in this implementation. So the problems start in a hospital. In a hospital, you probably know there is different department, and we will focus our example on the neurological department, where they are specialized in the brain analysis and the brain imaging. They use CT scan to get those data, and they definitely have a lot of data to process. There is a team behind who use tools in order to look at the image, to make diagnosis, and so on. But as you can imagine, there is a lot of data. There is a lot of data to build up a brain. There is slices less than 2 than each millimeters, so it's make a lot of data. A lot of data, and you have time pressure. So you have time pressure because you need to be performant, you need to solve this situation and make the diagnostic, of course. So in your team, you have probably diverse source of trouble. There may be the fatigue of your team. There might be also the time delay in the diagnostic. You need to perform the diagnostic. You may have 20 patients over the day, so you need to provide your diagnosis. And the last one, with the time pressure, the fatigue, the delay, you might miss some abnormalities in the slice and so on. So as a director, as a head of department, you need to find a solution. And there come the AI. You might need to think, oh, maybe I can use an AI tool. I don't know which one, but an AI tool that I can find on the market to help us in order to facilitate our diagnosis, in order to be more performant in the way we are working and so on. So for the next time, we will focus more on the AI developer company. So let's focus on this aspect for the moment, then we will discuss further the relationship between the hospital and them. But for the AI company, they developed a large amount of analysis of the images with an AI tool. It can be the ankle, it can be the brain, it can be the legs, it can be the feet, it can be a variability of diverse diagnostic. So basically, they use deep learning AI tool to analyze the CT scan and to perform and improve the diagnostic. They build a convolution neural network, and it's widely used in the neurological department. You can think about the PACS, for those who are deep involved in it. But that's just technical. The basic idea is that they are going to train the model, definitely. They are going to train the on CT scan. And where did we find those images? We found them on internet. It's a public database. It's reported on the website as anonymous. So we use them, and we try to implement those information and to train the model. Then the model is quite nice. It's flexible. It can be cloud-based. It can easily be integrated in hospital. And those systems are widely different, so it's quite easy and flexible. So that's for the situation we are in. So let's focus now on the AI developer company. And maybe if we follow the fact sheet of the CNIL, we can find the first question and discuss about the applicable legal regime. So I was wondering, when we ask this question as DPO, as legal, how can we see and distinguish the difference?
Yeah, firstly, we need to go to the AI Act, of course, and this AI tool will be used to aid in diagnosis. So we can consider that it will be a medical device, that it will be subject to third-party conformity assessment according to the medical device regulation, and so it will be a high-risk AI system per AI Act. And this developer company will be a provider, in this case located in the EU, but we know that for the AI Act, it can apply also for an US company, for example. And they will place in the market, they are planning to place in the market these systems, so they are under the scope of the AI Act. But then we need to look at the data that they are using. And in the case of the GDPR, the first question is, are we using personal data? And this is case-by-case analysis is something that you need to take into account because the concept of personal data is quite broad. Unless the data is considered anonymized, you need to comply with GDPR, and it's a high threshold. It's not really clear, and that because you find images in the internet, you can just use it as they are. So you need to make this analysis to see if they are personal data, and also in this case it will be sensitive data, which is subject to a strict regime. And then you will need to see what is your role according to the GDPR. If you are developing the AI tool for your own company or at your own initiative, you are collecting the data and you are developing, you will be a controller. You will be determining the purposes and the essential means. But if you're commissioned to perform, to create this AI tool, you may be a processor depending on the case. So also we need to take into account the huge risk that we can have in terms of data protection. Complying with the data protection principles as such data minimization, accuracy, transparency can be challenged in the case of AI. And also the risk of re-identification of data subjects, or the risk of inference of personal data that should be also taken into account alongside with the fact that maybe security risk also, and the complexity of the value chain will create some dependencies, and you will have to take this into account in terms of contractual clauses and vendor assessments.
I like this question about sensitive data, but we will come back on this question a little bit later because there is a diversity in the data that can be used in AI model and training. But first, let's discuss a little bit the different role qualification that we might foresee within the different step of the development of an AI tool. So we have here the different aspects, so maybe you can give us a more insight.
We try to make a simple illustration of how the role qualification of the parties may change during the AI life cycle. We have the role qualification according to the AI Act, the provider or deployer of the system, and we also have the role qualification about in the GDPR, controller or processor, and this role qualification will determine the obligations for the parties. In terms of GDPR, the controller will have the main obligations. They will have to make sure that they are complying with GDPR and that their vendors are complying with GDPR. So in the first phases, like data collection, training, testing, validating, AI Act may not apply, but GDPR still applies for personal data, and the provider will be the controller. And afterwards, during the use, normally the hospital in this case, the deployer will be the controller, because they will decide how to use the system and for what purposes. And then we have the output use, the use of the output data that could be done by the hospital, could be done by the development company, and that may have different problems, as we will see.
Yeah, we will come back to these two last steps, especially AI use and output, in the description afterwards. But let's come back a little bit before, during the training phase. So we discussed in this case that we will use publicly available images. So it's fine. They are public, they are provided as anonymous. So that might be interesting because then we are not anymore under the scope of the GDPR. So do we have to foresee any specialties in this way?
Sadly, the fact that the data is publicly available in the internet, in social media, does not mean that you can just disregard GDPR. GDPR still applies if it is personal data. Then you will have the problem of, is this personal data or not? Is this synthetic data personal data or not? This is something that is a case-by-case analysis, yeah.
Okay, so if we process data as per GDPR, we need to find a legal basis for this processing. So how do you foresee and how can we foresee this question? Especially because it might be indirect collection and direct collection in this case.
Yes, as we've seen in the CNIL presentation, it's really important to establish a specific purpose for the use of your data, and you have to follow through this purpose, and this purpose will determine the legitimate basis. In our use case, is an indirect collection of publicly available data, and the developing company should have has some responsibility of make sure that at least this database is not completely unlawful, is not obtained through a data breach or something like that. At least this due diligence must be done. And then afterwards, they have to, they need a legal basis for using the data. And here we have the legal basis that is possible. It's possible to use legitimate interest as legal basis, the legitimate interest of the AI company to develop this tool. For that, you need to balance the different interests, the interests of the company, the interests of the data subjects, but we think that it's possible that keeping in mind the scientific research purposes and the positive outcome for the patients, the balancing test can be positive, and you could use this legal basis. Then there's the possibility of consent, but in our case, this is a publicly available database, it's an indirect collection. You will probably not be able to identify and go and ask for consent for each patient, so probably it's not feasible to use it. And then obviously we need to take into account the transparency obligations, because either way there needs to be some information and some awareness by the data subject. And obviously in this balancing exercise, in this stage, we need to take into account the reasonable expectations of the subject and what they think the data may be used for.
Yeah, and if we move a little bit forwards in this case study, let's think another dimension of the process to develop an AI tool is the commercialization. So definitely we have something which is well working, so we need to populate it. We need the commercialization of the AI tool. So we might foresee at a certain point of time a relationship then with customers. And in our case, we can probably have a relationship between a site who will be interested in using this to improve the facilities, the diagnosis of the different slices in the brain. So in this case, they will enter in a relationship between a site and an AI developer. So probably the first question might be to focus in this situation really on the role qualification between those two companies. How can we foresee that based on both GDPR and AI Act?
Yeah, in this case, in our use case, the provider will be the processor and the deployer the controller for the reasons that we mentioned before. The reason is the party that determines the purpose and the essential means of the processing, but this could be way more complex. It could be a case where the hospital and the company or two companies want to develop the system at the same time. They could be controllers together, and but in any case, in our use case, this would be a relationship that needs to be framed contractually. The GDPR established some obligations that has to be put in the contract with the vendor, the service provider of the AI tool. And obviously, before the hospital will need to do the due diligence in terms of vendor assessment to make sure that they will comply with GDPR, and they are complying with GDPR because they're responsible in the end from a data protection point of view will be in the hospital, in the controller. So that will be really, really important for them.
Yeah, that's important. But again, we have a new processing there. So the processing is not exactly the same as we foreseen before. So it will be the use of this AI tool within hospital. The dataset will change also because it will be real data now, direct collection of the data. So we need to include in the record a new data processing line. So in this case, what can be the legal basis that we might foresee?
In case the hospital could use the consent as a legal basis, but it's not really straightforward with GDPR. The consent has to be very precise, very understandable for the data subject. It has to be tailored to the data subject. For example, if it is a minor, the consent request should be different. And we should take into account that it may be difficult to explain how AI works to a patient. And at least the patient should be aware of the risk and the possible impact for them for the use of the AI system. And this links with the requirement on the GDPR of transparency and explainability that is also mentioned in the AI Act and is one of the big challenges, especially in the case of black box systems. And on the other hand, we have the legal basis of the contract of the patient that goes to the hospital and they are receiving a service. And in this case, the hospital will need to make a balancing test between the different rights and interests. But in principle, we need to see that it will be positive. And as mentioned before, this is sensitive personal data. This is vulnerable data subjects, so this should be taken into account because the requirements are harder and you need to comply with a stricter regime in the GDPR.
Yeah, and to move forward with the use case that we present you, we can add it up a little bit of complexity in that and question about the output use. So what it is? So the AI company developer can foresee there, and maybe if you are in the situation, there is new data that you can use. And to do what? To improve your model, to see to what extent it's efficient enough in the real life situation. So you might have the idea to use actually the data provided by the site in order to improve your model, to be more efficient, maybe to also develop other tools that are more specific for your partner, in this case, the site and so on. So in this case, again, there is another processing activities. Do you think it's possible to foresee this situation? Can this AI company use the generated data from the hospital to improve its model?
Yeah, in the case of improving the model, it will be possible in theory to do it, but in other purposes, we will need a different analysis. In the case of direct collection from the development company, they could use consent informing of the use of the data. If it will be only used for improving the system, probably the patient will be giving consent. If it's after, for example, 5 years, you want to collect this data from this hospital, you will need to reach out to the hospital, and the hospital will do a compatibility test to see if the initial purpose of the use of the data, meaning the diagnosis and treatment of the patient, is compatible with the use for improving the system. And then, if the balance is possible, this compatibility test is possible, that we believe it is, because it will not be very risky for the data subjects. The provider needs to have a legal basis. In this case, it will be legitimate interest for improving the performance. And it's also possible that if the only purpose is to avoid bias, detect and eliminate bias, It's also possible to use the data. The AI Act in Article 10 says that it is possible to use sensitive data, such as health data, for this purpose, but you will have to comply with some security measures, pseudonymization, be sure that only the required data is used. But it's a possibility that is explicitly provided in the AI Act, as it is necessary to avoid bias in order to safeguard the rights and the safety of the data subjects.
I see. For now, we were quite a lot focused on the relationship between the processor, the controller, the developer, and the hospital, but we need to think a lot about the data subject as well. They are center in this situation, and it's also the purpose of the GDPR. So, in a way, is it mandatory to inform the data subject that we will use their data? We're using an AI tool, and also what can be the way to inform them? Is it a panel in the waiting room, or is it any other possibility to make that? And do we need to inform them actually?
Yeah, transparency is one of the main principles in GDPR. So yeah, we need to comply with the transparency obligations to inform the data subject about the purpose of the use of their data. So normally we will do that individually to each patient, but it may not be possible in practice. So if it is really impossible, if it's too much effort, you of course need to document this. You can just make the information publicly available. It could be a website, as you said. It could also be a poster in the waiting room, depending on the context of the situation. But in any case, you need to make sure that the data subject will receive this information. And this transparency is linked to the exercise of rights of the data subjects, the patients. And there are difficulties sometimes in regards to AI to exercise in practice these rights. You have the right of access, rectification, erasure, but it may be difficult, especially if the personal data is in the model, to determine which data belongs to this data subject, to erase the data. Is it possible? Can the system forget about the data? Can it be re-identified? Can we ensure that it will not be re-identified? And for this, it's key to establish strong data governance protocols that ensure that we have data mapping, we have the responsibilities of each actor put through, and we will see more about that.
Yeah. I would have a lot of questions to add, definitely. As a DPO, we foreseen a lot of those questions, but maybe we can wrap up a little bit with this comparison between AI Act and the different aspects. So what are maybe the key aspects we need to take care of?
Yeah, both regulations have similar purpose in terms of protecting the individual's rights. But there are also differences, like in the AI Act, you have to have a conformity assessment first. You need to demonstrate that you are compliant before putting the system in the market. But in the GDPR, you don't have this conformity assessment. You just go ahead with your processing, but you need to have in place all the documentation that proves that you are compliant. Otherwise, the CNIL or other data protection authority may come to you and ask you, why are you using the data? Are you putting all the measures in place to make the data secure? So the AI Act establishes some obligations for high-risk AI systems. We do not have yet the technical requirements, but we have the principles, and the principles allow us to establish some measures to really respect the principles. In some cases, the principles are really aligning with GDPR. In other cases, it may be more challenging. Data minimization. For AI, we need a lot of data, so data minimization can be challenging, but it can also be an opportunity, because GDPR requires that only the data that is relevant and accurate will be processed, and this also can help the functionality of the AI system. So we have all these principles to comply with: the transparency, the human oversight, which is really, really important also in terms of liability for the hospital to follow the instructions of use of the system. Documentation, in case of the GDPR, of course, is really, really critical because we need to know that we are complying. We need to be accountable, be able to demonstrate it. And data governance is also something that we are really used to in GDPR and in data protection in general, and it will be also a requirement for high-risk AI systems. We need to have in place data mapping. We have to have in place standard operational procedures, policies to make sure when the AI system can be used, by who, under which terms, to make sure that we detect any mistakes, any bias, and they can be corrected. So it's also necessary to establish the risk associated with the use of the system, both in GDPR and the AI Act. The AI Act will require that the deployer performs a fundamental rights impact assessment. But also in our case, you will need to perform a data protection impact assessment. They may overlap somehow, and you will need to try to reconciliate both assessments. And yeah, in any case, you will need to monitor, reevaluate, and keep working on it. And it's a moving target, and you will need to keep working on it.
Yeah, it's a moving assessment as well. There is a lot to do in the implementation of a system. So you have a short picture here, which is quite important because it depicts the different steps, and the different steps in this implementation need some assessment. But keep in mind also that in each of those steps, you need to probably keep in mind the data protection and the GDPR and other regulation maybe as well, because in each of those aspects you might processing personal data, and you cannot avoid this aspect and just put the GDPR and data protection aside of this. So I think yeah, we have a few time for question, or for one question maybe.
Any questions? Please raise your hand. Otherwise, there is a booth right over here where you can find the team.
Yeah, we are in booth 18 if you want to discuss any data protection related issues.
You started with a very nice example with the CT scans of the head. Can a CT scan of the head ever be anonymized because it has your unique profile of your face? My phone recognizes my face as well. So can you ever anonymize a CT scan of the head?
Yeah, that's a great question. I don't think you can, because there will always be a link to the person, to the patient. I don't think it's possible. That's my opinion. Then it is possible that you use other type of data for training your system, like synthetic data, and in some cases can be considered anonymous. But for the CT scans, I know that a lot of, there are people claiming that they are anonymous and so everything is okay, but I agree with you, it's not possible.
Thank you so much for your informative talk, and please do talk with Mydata-Trust in booth 18. Thank you, Noelia and Gregory. Let's give them a round of applause.